Hey guys, this is Dr. Hub. So today we'll look at the MAC. So what is the full form of this MAC? It is the minimum alveolar concentration. So what does the components of this MAC? So MAC, it is nothing but a minimum concentration of the inhaled. It is a minimal concentration. This is of the inhaled anesthetic. It is of the inhaled anesthetic, and this is nothing but at 1 atm. It is at 1 atm of pressure. It is 1 atm of the pressure, and it prevents the skeletal muscle movement. So it prevents the skeletal muscle movement. It prevents the skeletal muscle movement, and this is in response of the surgical incision in 50% of the patients. This is in terms of surgical incision in 50% of the patients. So let's look at the anesthetic agents now. So we are going to look at the anesthetic agents, and we are going to comment on the MAC potency and the blood gas coefficient. So first column will be the anesthetic agents, next will be the MAC potency, and the next column we'll call it the blood gas coefficient, that is the solubility. So let's see. First, to begin with, there is halothane. So under halothane, so the MAC potency is 0.75. So blood gas coefficient or solubility is nothing but 2.4. Next, we look at the halothane. That is we look at the isoflurane. So the isoflurane, this has a MAC potency of 1.2. So you'll be wondering, what is this? This will be in the decreasing order of the blood gas coefficients. So here the MAC potency is 1.2 and here it is 1.4. So what are the color codings? So halothane will be, it is red. Next comes isoflurane, this will be violet. Next is, we look at the enflurane. So how is this enflurane? Enflurane, this will be orange in color, and looking at the MAC potential, it is 1.7, and then the blood gas coefficient is nothing but 1.9. Now we move on to the sevoflurane. So how is the sevoflurane? So sevoflurane is nothing but, it is yellow in color, and the MAC potency, if you see, it is 2. So let's write it down. This is yellow in color, MAC potency, and the blood gas coefficient, that is a solubility. So this indicates the potency and this indicates the solubility. So how is it different? So this is, in sevoflurane is 2, MAC is 2, and then in case of the blood gas coefficient, it is 0.65. Next, we will look at the desflurane. So in case of the desflurane, the MAC potency is 6, and in case of the blood gas coefficient, it is 0.42. So what is the color here? The color here is blue. And then we move on to the nitrous oxide. So nitrous oxide, the MAC potency is a maximum, that is, it is 104. So MAC potency is 104, and the blood gas coefficient here is 0.47. So the color here is, it is purple. So now what we need to know is the MAC is an indicator of the potency. So the lower the MAC, the higher is the potency. So if the MAC is the least, the potency will be the maximum. So the MAC in case of nitrous oxide is maximum, so the potency will be less. Whereas in case of halothane, the potency, the lower the MAC is low, so the potency will be the maximum. So next we will also focus on the blood gas coefficient of inhaled anesthetics. We will also put a light on this. Inhaled anesthetics. So under this, first is the low blood gas partition coefficient. So low blood gas partition coefficient. So this, it goes to the low solubility in the blood. So there is low solubility in the blood. Next comes the higher alveolar concentration. Next comes the higher alveolar concentration. And this higher alveolar concentration, it can lead to the faster induction and recovery. So it leads to the faster induction as well as the recovery. So this was all about the minimal alveolar concentration. We have seen the definition, we have seen the anesthetic agents, we have seen the potency as well as the coefficient. Important thing to note was that the lower the MAC is, the higher the potency. And then we also saw a flow chart. So to learn and grow daily like this, please do subscribe.